May Finlay. I am here with Marlene Longbottom. We've been attending the Lowitja and NHMRC Research Translation Conference, and we're just having a yarn with Marlene about what she considers to be research translation from her perspective, and also some of the experiences she's had with research translation and knowledge translation in communities.
Mm-hmm. Thanks, Summer. For me, research translation in the community context is about community organisations and community people being able to use the knowledge that's gained from research, and whether that's the results of a research project, methods that are applied, and it's actually how they can tangibly use that information in their service delivery. I think that, and in the space that I'm working in with Aboriginal community controlled health services, I think there's a great capacity already on the ground. And I think that that capacity is often overlooked at times because there's a lot of different types of capacity, whether it's cultural capacity, whether it's clinical knowledge, whether it's community access. So in order to do research in community organisations, it's important to understand that knowledge, and there's a high level of skill base already there. And how do we enhance that so that they can actually use the outcomes from the research?
And that's really important, because I mean, we were just talking before about how when you hear people talk about capacity building, they often assume, if they're not Indigenous, that we're coming from ground zero. That is never the case in our communities.
No.
And it's actually building on the existing knowledge so that then people can do even more for their communities.
Yeah, I think it comes back to one respect that, you know, our communities and community organisations in particular actually have a skill set that, you know, that you wouldn't find anywhere else. So I think it's really important to understand that whilst some enhancement might be needed, we need to understand about the things around, you know, what is truly research capacity building, rather than coming from that ground zero type of attitude of there's no skill base. I was a health worker back in the day, you know, 20 years ago.
Can you take the health worker out of the woman though?
No, you cannot. And, you know, I still fall back on those times where we had researchers coming in for me to use this machine. I didn't get the capacity building in research, but I got the capacity building in using a machine.
Right, so that's that reciprocity in the tangible benefits to community. Yeah.
So, and then how does community actively negotiate research proposals?
Yeah.
So when capacity is enhanced, and I've actually seen this in my community back home in the Shoalhaven, where we've got a number of community-controlled organisations who have actively been engaged in the research process, who are now coming to research institutions saying, this is what we need. Not the other way around. Researcher coming into the community saying, I've got this research project, do you want to be part of it? So that's knowledge translation to me.
Absolutely. James Ward said this morning that there's so much research that's still investigator-led, but I like to think that's last century's research. We need to get with the times, and if you want to continue doing research in our communities, it's got to be done, led by us.
It has to be led by us, and if you're uncomfortable about that, don't do that research. Don't think that you can just go and get an NHMRC grant and then come to the community. If they're not at the table with you at the start, then you're already assuming a power base and that you know more than the community. So it's really important to understand the power imbalances. If you want to work in a community, make those connections, work with them, spend quality time, and then have them come to the table and have them decide whether it's a priority for them.
Yeah, because knowledge is power. That's been one way of actually keeping our mob down, is actually withholding knowledge. And
well, who wrote the history books?
Certainly not us.
That's
well,
right.
we are rewriting them now.
Yeah, we are rewriting them now. We're rewriting the way in which research is done and how it's translated. This is the history that we've come from, and we have to understand there's a power imbalance in that. So when you have people like yourself and I who are coming through the institutions,
We'll be deadly doctors one day.
Yeah, you know, research doctors and things like that. It's you have to understand that reign is you know, the reign of the stranglehold, I guess, is actually coming to a close. How do you work with us in these spaces?
Yeah, And I think, I don't know how you feel, but Indigenous peoples are actually really generous. We're generous with our time, we're generous with our knowledge, and if you do come with the right mindset, then we are very happy to engage with you and share. But once that door's closed because you've, screwed up, it's a little harder.
Yeah, community, in my experience, are forgiving, however they are wary. And I mean, if you mess up severely after they've advised you how to do something appropriately, well then that's on you.
Yeah.
But if you come with a genuineness and a very real perspective, and working with, not on.
Yeah.
So we're not researching the Aborigines anymore.
Yeah.
So it's about understanding that, that's a language that used to oppress us and suppress our voices. And as Aboriginal researchers, we walk a fine line in between two worlds. We navigate the institutions and we navigate the community. Well, I do.
Yeah.
I do. So I will always come from the community's perspective and making sure that the research is one of benefit to them, that it's actually a priority to them, that it's going to enhance service delivery and it's going to help the health and well-being of community, not just because someone wants to get a PhD.
Something that Carrie, one of the keynote speakers, said that really resonated with me was talk less and listen more.
Yeah.
And I think that that's something that probably needs to happen within the research space a bit more, and potentially the policy space as well. Yeah,
I think so. I think in saying that, we've already seen, government say no, that, with the Uluru Statement and things like that. I mean, the only way we can counteract those types of things and get into the policy space is to have research done to affect change. And if it's because everyone needs evidence, but it's like you said, it's talk less, listen more. And I think that's probably a big take-home message, because I've had people just talk at me and ask me questions.
The blacksplaining?
The blacksplaining, and you get tired from that, of that. You get tired of, there's a new